Hi guys, what's up? Hi guys, what's up? Welcome back. I am Shiv Virmani, Indian medical student and authors of a book PharmacEasy, and welcome to Unacademy. Welcome back. So this is the fifth session of MCQ. So we have started with the MCQ CNS MCQs, but uh, they are quite large. So they are 400 in number. So अगर 400 एक ही क्लास में हमने कर दिए तो मज़ा नहीं आएगा, राइट? सो और बहुत ही ज़्यादा बड़ी हो जाएगी, बोरिंग सी हो जाएगी. सो आई डिसाइडेड दैट वी शुड distribute few MCQs in each classes. So this is the fifth session of MCQ and hopefully the second last session of the MCQs. Till now we have completed the 200 MCQs, right? So in this class, target is to complete till 300, number 300, right? So our target is to complete 100 MCQs in this session, and yeah, let's start. So guys, welcome to Unacademy, and online and Unacademy is the best online learning platform, top level of online learning platform. And this way, you all must be knowing that how you can install an Academy app. So you have to write an Academy or an Academy Learning app on Play Store or App Store, and from there you can easily download it. You can easily download this app and or install, and after downloading you get access to attend live classes, live special classes, right? And the live special classes are taken by top level of educators, right? So you can ask your query and आप कुछ भी पूछ सकते हो and आपका आंसर वहीं पर रिप्लाई दिया जाएगा एजुकेटर से. तो दिस इज रियली बेनिफिशियल थिंग. प्लस आप अगर प्लस सब्सक्रिप्शन लेते हो देन you can access the live classes, you can take live tests, you can take live quizzes, plus batch courses. You can enroll in few batch courses, in all the batch courses you love. Then structured schedule, you get this structured schedule, right? This is really important. So these are the benefit of the plus subscription. Plus guys, अगर आपको नहीं पता, then Unacademy and Prep Ladder, they both are collaborated, and they have created a course that is iconic. And in this you have the access or to all the Unacademy के जो benefits है. प्लस प्रेप लैडर की अगर मैं बात करूं तो प्रेप लैडर की प्री रिकॉर्डेड वीडियोस को भी आप एक्सेस कर सकते हो. यू कैन टेक क्यूबैक 2.0 रैपिड रिवीजन कोर्स को भी एक्सेस कर सकते हो. देन हैंड रिटन नोट्स भी मिलेंगे. And if you want to buy the course, then you can use the code VIRMANI Virmani, and you will be getting 10% off, right? And yeah, let's begin with the MCQ 201. So let's just jump to the 201 MC. Yeah, so the question number 201 is, the selective MAO-B inhibitor out of the following is. So what should be the answer? So your options are seleginil, chlorgyline, moclobemide, and tranylcypromide. So your time starts now, and you will be getting 30 seconds for each question. Ten seconds left. So 201, the selective MAOB inhibitor out of the following is A seleginib, and yes, आपने आंसर भी सही करा है. And 202 पे चलते हैं. An antidepressant drug which is known to have both high sedative and anticholinergic activity is an antidepressant which is known to have both high sedative and anticholinergic activity. So कौन सी ड्रग है ये? The antidepressant drug which is known to have both high sedative and anticholinergic activity is which drug? So your time starts now. 10 seconds left. 3, 2, and 1. So 202 का answer is B amitriptyline, and technically you are right. Amitriptyline is correct. Basically आपको सबको पता ही होगा amitriptyline का side effect क्या है. तो most prominent side effect जो दिखता है that is blurring of vision and dry mouth and urinary retention, right? So this is the side effect of the amitriptyline. मतलब significant side effect. So this is because of the anticholinergic property. So 202 is done. And yes, you guys are also right. So 203 पर आते हैं 203, and all of the following are limitation of the typical tricyclic antidepressants except. So A option is narrow safety margin, B low oral bioavailability, frequent side effects, long latent period for response. So what should be correct? So your time starts now. So 3, 2, and 1. Yeah. तो करेक्ट आंसर मतलब इसका एक्सेप्शन और द लिमिटेशन ऑफ द ट्राइसाइक्लिक एंटीडिप्रेसेंट्स आर ऑल बट लो ओरल बायोअवेलेबिलिटी इज नॉट सीन. बेसिकली आपको पता हो तो टिपिकल एंटीडिप्रेसेंट्स आर हैविंग good oral absorption, they are having good oral absorption, guys, right? So this is absolutely wrong. Low bioavailability is absolutely wrong. And 204 का अगर हम देखें, one of the following limitations of typical tricyclic antidepressants has been overcome by selective serotonin reuptake inhibitors, which is, so one the following limitations of typical tricyclic antidepressants have been overcome by selective serotonin reuptake inhibitors, which is A frequent anticholinergic, sedative, hypotensive side effects, high risk of cardiac arrhythmias and seizures in overdose, delayed response. Then both A and B are correct, right? So your time starts now. 5 seconds are left. Three, two, one, and go. So what is the correct answer, guys? What is the correct answer? So one of the following limitation of typical tricyclic antidepressants has been overcome by selective serotonin reuptake inhibitors, which is both A and B. So frequent anticholinergic sedative hypotensive side effects plus high risk of cardiac arrhythmia and seizure and overdose. Right? Delayed responses. No. So D is the correct option. Basically A and B. Right? And 205 पर आते हैं तो nowadays the selective serotonin reuptake inhibitors are preferred drugs for which of the following psychiatric disorder apart from their role in the treatment of depression. So nowadays the selective serotonin reuptake inhibitors are preferred drugs for which of the following psychiatric disorder apart from their role in the treatment of depression. uh, so SSRIs का और का काम होता है. So you are having option phobias, OCDs, post-traumatic stress disorder, and all of the above. So your time starts now, and it is really easy question, guys. Really easy question. 10 seconds are left, and yeah, it's very easy question. Yeah. So time is over, and we are having our correct option, that is D, all of the above. So, SSRIs are used in phobias, in OCDs, in post-traumatic stress disorder. So, all of the above is correct. And 206 पर आते हैं. A patient has been diagnosed to be having mania and bipolar disorder. Which of the following drugs can be used in this patient apart from lithium? So, patient has been diagnosed to be having mania and bipolar illness. तो कौन सी ड्रग देना, तो कौन सी ड्रग प्रिस्क्राइब करोगे अपार्ट फ्रॉम लिथियम? सो योर ऑप्शंस आर कार्बामेजिपिन, कैरिसिप्रोडेल एंड क्लोमिप्रामिन एंड डाइथाइल कार्बामेजिपिन. So your time starts now, and yeah. So guys, 10 seconds are left, and yeah, and we are having answers as well. Five, four, three, two, and one. So, guys, the correct answer is A, carbamazepine. So, apart from lithium, carbamazepine is the preferred drug, right? Carbamazepine is the drug that is given apart from lithium. So 207 पर आते हैं. Which of the following statements about extrapyramidal effects of antipsychotic drugs is false? So which of the following statements about extrapyramidal effects of antipsychotic drugs is false? So A is caused by blockade of dopamine receptors, less likely to be produced by clozapine than chlorpromazine, can be countered to some degree of antimuscarinic drugs. Haloperidol does not cause extrapyramidal syndrome. So what should be correct? What should be correct? Caused by blockade of dopamine receptors, less likely to produce by clozapine than by chlorpromazine, can be countered to some degree of antimuscarinic drugs. Haloperidol does not cause any extrapyramidal syndrome. So what should be correct? So your time starts now, and Yeah, Prabhakar, you are right. Yes, Prabhakar, you are right. Egg number, you are also right. And still, we are on 10 seconds. 3, 2, and 1. So, guys, it's saying which of the following statement about extrapyramidal effects or side effects of antipsychotic drug is false? Caused by blockade of the dopamine receptors, yes, this is true. Less likely to be produced by clozapine than chlorpromazine, yes, this is also true. Can be countered to some degree of antimuscarinic drugs, yes, this is true. But जो D option है, that is haloperidol does not cause extrapyramidal syndrome. No, this is absolutely false. Haloperidol is a antipsychotic drug and it is having high potency that it can cause extrapyramidal side effects, right? Akathisia dystonia, tardive dyskinesia, Parkinsonism, and all of that. न्यूरोलेप्टिक मैलिग्नेंट सिंड्रोम एंड 208 पर आते हैं साइकाइट्रिक पेशेंट टेकिंग मेडिकेशन डेवलप्स अ ट्रेमर thyroid enlargement and leukocytosis drugs implicated is a psychiatric patient taking medication develops a tremor thyroid enlargement and leukocytosis and जो drug है that can be clomipramine haloperidol lithium or olanzapine so your time starts now एंड इसके बारे में हम पहले अच्छे से डिस्कस कर चुके हैं सेशन में आई होप यू ऑल रिमेम्बर सो 10 seconds are left 10 9 so 5 4 3 2 we are having correct answers that is lithium yes lithium is having high potency that it can cause thyroid enlargement with leukocytosis that's why it is used in neutropenia as well and tremor के अंदर भी it is useful so नो यूजफुल नहीं मतलब कि इट कैन कॉज दीज थिंग्स सो दैट्स व्हाई इट इज यूजफुल इन न्यूट्रोपेनिक सो न्यूट्रोपेनिक पेशेंट्स के अंदर ल्यूकोसाइटोसिस और न्यूट्रोपेनिया पहले डिक्रीज सेल हाई सेल तो ये इक्विलिब्रियम पोजीशन में आ जाएगा राइट इट कैन कॉज ट्रेमर इट कैन कॉज थायराइड एनलार्जमेंट आई होप आपको समझ में आया होगा कि साइकाइट्रिक पेशेंट है उसके अंदर साइड इफेक्ट डेवलप हो गया राइट ट्रेमर्स थायराइड एनलार्जमेंट एंड ल्यूकोसाइटोसिस तो ल्यूकोसाइटोसिस इज द साइड इफेक्ट जो कि हम यूज कर सकते हैं राइट ऑफ द लिथियम एंड 209 की अगर हम बात करें तो MAO inhibitors can are contraindicated in following conditions except with TCAs with indirectly acting sympathomimetics with cheese with aspirin so what is the exception and your time starts now ten seconds are left so time is over and I think we are having the correct answers that is D aspirin तो एस्पिरिन का सच कोई इंटरेक्शन नहीं होता विद एमएओ इनहिबिटर्स बट अगर एमएओ इनहिबिटर्स दिए विद ट्राइसाइक्लिक एंटीडिप्रेसेंट्स विद इनडायरेक्टली एक्टिंग सिम्पैथोमाइमेटिक्स लाइक टायरामीन और एम्फेटामीन एंड चीज सो चीज के अंदर भी टायरामीन इज ओनली प्रेजेंट so there can be hypertensive crisis right so there would be increased rise in BP So increased rise in BP. So that's why और इसका treatment is pentolamine, pentolamine, right? And 210 की अगर हम बात करें, patient Rajneesh having depressive disorder has taken 25 times the normal dose of amitriptyline. So 25 times, right? मतलब suicidal tendency. Which of the following is not likely to be observed in this patient? Coma, shock, hot dry skin, hypotension, or pinpoint pupil. So not likely. It's asking not likely. So your time starts now, and I am giving you 50 seconds for this. 3, 2, and 1. So time is over, guys, and the patient has administered the 25 times the dose of amitriptyline, basically. So amitriptyline is a TC, right? TC is having an anticholinergic action. Anticholinergic action का eye पे क्या effect होता है? Mydriasis. So how can it cause pinpoint pupil? So pinpoint pupil is will not be seen in this poisoning case. So D would be correct, right? And 211, a patient Manoj with severe pain thought to be of GI origin received 60 mg of meperidine, subsequent to which he developed reaction characterized by tachycardia, hypertension, hyperpyrexia, and seizures. He gave the history that he is also taking some medicine for his psychiatric condition. Which of the following drug can be held responsible for this sort of reaction? So, a patient Manoj with severe pain thought to be GI origin received 60 mg of meperidine, right? उसके बाद उसको effect reaction start हुआ like tachycardia, hypertension, hyperpyrexia, and seizure. So, which of the following drug can be held responsible for this sort of reaction? So the drugs are alprazolam, imipramine, lithium, and phenazine. And your time starts now. So listen, meperidine is pethidine only, right? So the drug that can cause is phenelzine. So क्या हो रहा है basically? जो pethidine है, आप सबको पता है pethidine is a opioid analgesic. Opioid है basically and higher potency to cause seizure. So uh, so basically क्या होता है कि what will happen here is phenelzine क्या करेगा pethidine को ज़्यादा से ज़्यादा convert करेगा norpethidine में and thus there can be condition like this, right? So phenelzine is the correct answer. And I hope it's clear. Meperidine is just like pethidine, right? Same as pethidine. So as pethidine converts to the norpethidine and norpethidine is having a high seizure potential, that's why meperidine will gets converted to the normeperidine and thus it can cause severe seizure disorder. And let's come to 212 question. And patient presents in your psychiatric OPD with complaints of diminished vision. So diminished vision. Ophthalmological examination revealed corneal and lenticular opacities. He had been prescribed some antipsychotic drug during his last visit. Which of the following it can be? So the drugs are thyroidazine, haloperidol, flufenthixol, and pimozide. तो कौन सी ड्रग है ये? थायोरिडाजिन, हेलोपेरिडोल, फ्लूफेनथिक्सोल एंड pimozide. So your time starts now. 10 seconds are left. 3, 2, and 1. So the correct answer is A, thyroidazine. So thyroidazine has higher potency to cause reticular degenerations and all of this. So basically corneal degeneration, lenticular degeneration, right? So इसकी वजह से there can be opacities thyroidazine की वजह से. And let's jump to the 213. A patient, Ashwani, has been brought to the hospital with non-stop talking, singing uncontrollable behavior, and apparent loss of contact with reality. तो इसका मतलब ये कौन सी स्टेट में है? साइकोसिस की स्टेट में है, राइट? बेसिकली जो दो ग्रुप की बात करी थी हमने, वन इज साइकोसिस एंड अदर वन इज न्यूरोसिस, तो उसको नहीं पता, दैट्स व्हाई वो साइकोसिस के अंदर है. And you diagnosed to be the case of acute mania, right? Which of the following is the most suitable drug for the rapid control of his symptoms? So first drug is lithium carbonate, then phenobarbital, haloperidol, and valproic acid. So these are the four options, and your time starts now. And what should be the correct option? So your time, only 5 seconds are left. And yeah, as question is saying that rapid control of his symptoms. रैपिड कंट्रोल, रैपिड, सो फॉर रैपिड कंट्रोल यू विल बी प्रिस्क्राइबिंग हैलोपेरिडोल. अगर आपको होता कि बेस्ट कंट्रोल कौन सा, बेस्ट ड्रग कौन सी होगी, देन यू वुड बी राइटिंग लिथियम कार्बोनेट. बट लिथियम कार्बोनेट यू ऑल मस्ट बी नोइंग दैट 5 टू बेसिकली अ प्रोलॉन्ग्ड थेरेपी पर ही रिजल्ट आता है, immediate action is not produced. So we want a rapid control. So rapid control के लिए what you will be prescribing? Haloperidol, right? Then comes the 214th question. Uh, so a hypertensive patient Sattu, already receiving a drug X, to control his BP, was prescribed a tricyclic antidepressant. This resulted in abolition of the antihypertensive action of X. Which of the following drug can be X? So and the options are enalapril, clonidine, atenolol, and diltiazem. So your time starts now. 10 seconds are left, guys. So B is the correct answer, clonidine. So basically, clonidine is a is an antihypertensive drug, right? A hypertensive patient that is already receiving clonidine to control the BP was prescribed at TCA as well, right? And this resulted in the abolition of the hypertensive action of clonidine, and that's why clonidine gives a hypertension fee, and the drug is clonidine. Simple as that. So 215 पर आते हैं. A patient of endogenous depression was prescribed imipramine. After what duration of time interval is the therapeutic effect of imipramine likely to manifest? A patient of endogenous depression was prescribed imipramine, right? After what duration of time interval is the therapeutic effect of imipramine likely to manifest? Right. So your options are 3 days, 1 week, 3 weeks, and 3 months. And your time starts now. And three, two, and one. So what is correct answer, guys? So C, 3 weeks is correct. And tech number has given the correct answer. C, 3 weeks. Imipramine का ड्यूरेशन जो लगता है that is 3 weeks action produce होने में. Then comes 216. After starting a patient on imipramine, his heart rate rises to 120 per minute and he has blurred vision. So this effect can be explained by the fact imipramine is a muscarinic antagonist, potentiate epinephrine, is a ganglionic blocker, is a potent alpha adrenergic blocker. So what should be the correct option? And your time starts now. बहुत easy question है ये तो. So we are having answers and 10 seconds are still left, but it's a really easy question. So A is a muscarinic antagonist. So it will be having potential anticholinergic effects. So that's why blurred vision and all of these symptoms are produced. And now comes the 217. A 46-year-old male patient, Prabhash, was treated for depression, was admitted being treated for depression was admitted to the emergency with severe confusion and hallucinations. Severe confusion and hallucinations. His mouth was dry, his face was flushed. On examination, his blood pressure was found to be 84 by 62 mm of Hg. So that is really low. Both systolic and diastolic are low. His heart rate is 108 beats per minute due to reflex tachycardia. So, reflex tachycardia and ECG of the patient reveals sinus tachycardia and prolongation of PR, QT interval, widened QRS complex, and which of the following agent would best correct the patient cardiac abnormality? So, हमें क्या करना है अब इस patient को? So, ECG of the patient is sinus tachycardia and prolongation of PR and QT interval is also seen. Wide QRS complex is seen. तो कौन सी ड्रग दोगे जिससे ये सब चीज ओके हो जाएगी एंड योर टाइम स्टार्ट्स नाउ. Yeah, these are the symptoms are because of TCA overdosage. So the correct option should be D, that is sodium bicarbonate, because we want to remove the TCAs from the blood. So these are the symptoms because of the acute TCA poisoning. राइट सो टीसीए को की पॉइजनिंग के लिए हम सबसे पहले क्या करेंगे, हम सबसे पहले एबीसी मेंटेन करेंगे। एबीसी मेंटेन करने के लिए हमें पहले इस टीसीए को निकालना पड़ेगा ब्लड से। सो फॉर दैट वी विल बी एडमिनिस्ट्रिंग सोडियम बाइकार्बोनेट, एंड सोडियम बाइकार्बोनेट हम इन्फ्यूज करेंगे ताकि अल्कलाइनाइजेशन ऑफ यूरिन हो, एंड टीसीए इजीली बाहर निकल जाए। एंड देन हम इसके साथ साथ मैनिटॉल 20% भी यूज कर सकते हैं, बट स्टिल अगर इम्प्रूवमेंट नहीं हुई देन हीमोडायलिसिस, एंड डी इज द करेक्ट ऑप्शन। तो ए भी ऑप्शन है, बट ए कैसे होगा? प्रोपेनोलॉल इज द ड्रग कार्डियो सिलेक्टिव बीटा ब्लॉकर। अगर ये दे दी देन बीपी वुड और डिक्रीज। तो अगर प्रोपेनोलॉल दे दी तो ये जो बीपी है ये और ज्यादा डिक्रीज हो जाएगा, एंड पेशेंट कैन डाई एज वेल। यस, हार्ट रेट डिक्रीज हो जाएगी, बट एट द सेम टाइम बीपी बहुत ज्यादा डिक्रीज हो जाएगा प्रोपेनोलॉल से। तो it should not be prescribed. And a 45-year-old male patient Sanjeev was brought to the emergency with severe agitation and aggressive behavior. He was started on haloperidol and the patient became responsive and cooperative. After 8 days of the treatment, he developed high-grade fever, diarrhea, confusion, and muscle rigidity. Which of the following should be used for the treatment of this condition? So first is diazepam, B is benzexol, then dantrolene, then high doses of haloperidol. So your time starts now. So the correct answer is C, dantrolene. So देखो 45-year-old male patient है, and Sanjeev was brought to the emergency, severe agitation, aggressive behavior. He was started on the haloperidol and the patient became responsive and cooperative. After 8 days, high grade fever, diarrhea, confusion, muscle rigidity. So ये condition जो है, this is side effect that is that comes under the EPS, and इसका treatment should be dantrolene. And drug of choice of intractable hiccups is, so the drugs are metoclopramide, fluoxetine, selaginil, and chlorpromazine. So what should be the drug of choice? Ten seconds are left, and three, two, and one. So drug of choice of the intractable hiccups is chlorpromazine is the best or most commonly used. Most commonly used is this, but at the same time we can use benzodiazepines as well. We can use gabapentin as well. We can use metoclopramide as well, right? So and we can use baclofen as well. But most commonly chlorpromazine is used, so that's why drug of choice for intractable hiccup is chlorpromazine. Then 2020 की हम बात करते हैं, तो all of the above drugs, all of the following drugs cause prolactinemia except. So this is really very easy question. So A is haloperidol, chlorpromazine, bromocriptine, and metoclopramide. So what should be correct? Your time starts now. So your time is 3, 2, 1 खत्म. हाँ, तो bromocriptine is the correct drug that basically that is used to treat the hyperprolactinemia, right? Hyperprolactinemia is generally treated with bromocriptine. तो ये बात तो आपको समझ में आ गई ना कि जहां पर D2 ब्लॉक होगा वहां पर प्रोलैक्टिन बढ़ेगा और जहां पर D2 बढ़ेगा वहां पर प्रोलैक्टिन कम होगा, राइट? एंड 2 1 की बात करते हैं तो ड्राइनेस ऑफ माउथ कॉज्ड बाय एंटीसाइकोटिक ड्रग इज कॉज्ड बाय ब्लॉकेड ऑफ ड्राइनेस ऑफ माउथ बाय एंटीसाइकोटिक ड्रग इज कॉज्ड बाय द ब्लॉकेड ऑफ मस्कारिनिक एसीएच रिसेप्टर, गाबा रिसेप्टर, सेरोटोनर्जिक रिसेप्टर, डोपामिनर्जिक रिसेप्टर. So your time starts now. इतना इजी है वैसे तो. दिस इज अ रियली रियली वेरी इजी क्वेश्चन. This is really very easy question and 3 2 and 1. So this was really very easy question. So dryness of mouth किसकी वजह से होता है? Muscarinic ACH receptor blockade की वजह से होता है, right? Dryness of mouth, blurring of vision, all of that. And let's head to the another question. तो 2 2 2 पे हम आ गए हैं. And selective serotonin reuptake inhibitor are the drug of choice for the following conditions, except acute panic attack, social phobias, post-traumatic stress disorder, and generalized anxiety disorder. तो ट्रिपल टू किस किस चीज में काम बेसिकली कहाँ कहाँ काम आता है? एक्सेप्ट. योर टाइम स्टार्ट्स नाउ. 10 seconds are left. So your time is over, and SSRIs can be used for social phobias, for treating post-traumatic stress disorder, for treating generalized anxiety disorder, but they cannot be used for an acute panic attack. Right. So this is fine. And 2 2 3 पर आया तो prophylactic plasma concentration range of lithium in milliequivalent does not include 0.5, 0.8, 0.6, and 1. So your time starts now. हमने ये अच्छे से डिस्कस करा था. आई होप यू ऑल मस्ट बी रिमेम्बरिंग. So your time is over, and yeah, we are having the correct answer, that is B. So prophylactic plasma concentration range of the lithium is from 0.5 to 0.8 milli equivalent, right, per liter. So 1 नहीं होता, right, and अगर more than 2 हो जाएगा then it can cause toxicity. And now comes the drug having proven efficacy in bipolar depression is carbamazepine, valproate, tiagabine, or lamotrigine. So what should be the drug? And your time starts now. 20 seconds are left, and one. The drug having proven efficacy in bipolar depression is lamotrigine D. So this is the drug that is proven in the bipolar disorder, that is lamotrigine. तो 2 to 5 की बात करते हैं. द ड्रग ऑफ चॉइस फॉर रैपिड साइक्लर्स इन मैनिक डिप्रेसिव साइकोसिस इज रैपिड साइक्लर्स के अंदर रैपिड साइक्लर्स मतलब कि देयर इज अ मैनिक स्टेज एंड बहुत ही कम इंटरवल पर देयर इज डिप्रेशन, देन देयर इज मेनिया, देन अगेन देयर इज डिप्रेशन, देन अगेन देयर इज मेनिया, देन अगेन देयर इज डिप्रेशन. दीज आर रैपिड साइक्लर्स. इसके अंदर द ड्रग ऑफ चॉइस शुड बी, and your choices are carbamazepine, valproate, phenytoin, or lithium. So your time starts now. Ten seconds are left. 3, 2, and 1. So, guys, drug of choice for the rapid cyclers in manic depressive profile psychosis is B valproate. So, this is the drug that is the drug of choice for rapid cyclers in manic depressive psychosis. Then 2 to 6 is the question, and ekathisia is treated by all except trihexyphenidyl, propranolol, haloperidol, or promethazine. So trihexyphenidyl is also called as Benz, right? And इसका आंसर बताओ, and your time starts now. It's really very easy question. Ten seconds are left. 3, 2, and 1. So you guys have also answered correctly, and answer is C, haloperidol. Haloperidol is itself an antipsychotic drug, and akathisia is a EPS in side effect, right? EPS side effect किसकी वजह से? Antipsychotics की वजह से. So central anticholinergics can be used like this. Propranolol can be used. Promethazine can be used. Is antihistaminic drug. So haloperidol cannot be used. What are you saying, Aryan Pandey? uh, भाई तू पढ़ ले ये पूरा क्वेश्चन अब नहीं आई गेट क्लिनिकल विटनेस टाइम. What are you asking, man? Which of the following drug causes sedation but no extrapyramidal side effects? So, which of the following drug causes sedation but no extrapyramidal side effects? Clozapine, pimozide, flufenazine, or haloperidol. So, your choices are these, and your time starts now. Ten seconds left. So, which is the drug? So, which of the following drug can cause sedation but no EPS? So, what is the correct option? Is clozapine. So, clozapine can cause sedation but no EPS. Right. 228 की बारी आती है. Ekathisia is seen with the use of clozapine, propranolol, benztropine, or haloperidol. So, this is also really very easy question, and your time starts now. B, 2, and 1. So, you all must be knowing that ekathisia EPS is the most seen side effect of haloperidol or antipsychotic. Then, which are the following not side effect of clozapine? Agranulocytosis, seizure, scoliosis, and weight loss. So, clozapine का कौन सा side effect नहीं है? And your time starts now. तो clinical वाला question आएंगे. One more. 3, 2, and 1. And which of the following is not a side effect of clozapine is weight loss, right? Weight loss is not seen with clozapine. You can see agranulocytosis, seizure, sialosis, but you cannot see weight loss with clozapine. तो आर्यन, देखो, क्लिनिकल क्वेश्चन आएंगे. ठीक है, आप कह रहे हो क्लिनिकल क्वेश्चन आएंगे. यस, क्लिनिकल क्वेश्चन आएंगे. अगर आपने मेरी पुराने सेशन अटेंड करे हैं, या आपने मेरा एंटीबायोटिक वाला एमसीक्यू वाला सेशन अटेंड करा है, एंटीबायोटिक वाला जो एमसीक्यू है उसके अंदर बीच में मैंने डिस्कस करा था कि देखो, थ्योरी सेम है, ड्रग्स सेम है, ड्रग्स के एक्शन सेम है, ड्रग्स के साइड इफेक्ट सेम है. तो अगर देखो, जैसे पीछे वाला क्वेश्चन था हमारा, एकाथीसिया इज नॉट सीन विद द यूज ऑफ दिस. तो ऐसे ही पेशेंट पे क्वेश्चन आ सकता है कि देयर इज अ 35-year-old male patient जो साइकोसिस जिसको हुआ, एंड उसको एक ड्रग दी दैट दैट कॉज्ड हिम एकाथीसिया, राइट? सो फिर आपको ये ड्रग दे दी चार कि किस ड्रग से ये एकाथीसिया वाले साइड इफेक्ट हुआ। तो फर्स्ट वाज क्लोजापिन, प्रोपेनॉल, बेंजोप्रोपिन एंड हेलोपेरिडोल। सो एमसीक्यू तो सेम रहा ना, बेस सेम रहा, फॉर्मेट चेंज हो गया, राइट? क्वेश्चन पेपर के अंदर ड्रग्स तो नई नहीं आ जाएंगी, ना ही उनका साइड इफेक्ट बढ़ेगा, ना ही उनका साइड इफेक्ट कम होगा, ना ही उनका साइड इफेक्ट चेंज होगा। सो बेस इज दिस। सो दीज एमसीक्यू, अगर आप ये वाले एमसीक्यू करते हो ना, तो आपकी थ्योरी स्ट्रांग होती है, और एक बार आप थ्योरी स्ट्रांग कर लोगे तो कोई भी एमसीक्यू आप सॉल्व कर सकते हो, राइट? तो विद एमएओ इनहिबिटर्स फूड नॉट बी गिवन इज, कौन सा फूड एमएओ इनहिबिटर्स के साथ नहीं देना चाहिए? सो फर्स्ट ऑफ ऑल देखो, अगर इसी को ही मैं क्लिनिकल पॉइंट ऑफ व्यू से दिखाऊं, सो अ पेशेंट दैट वाज टेकिंग एमएओ इनहिबिटर्स, और एमएओ इनहिबिटर्स की जगह उसने ड्रग का नाम ले लिया, तो अ पेशेंट टेकिंग दिस ड्रग, सो उसको कौन सी फूड आइटम नहीं लेनी चाहिए अपनी डाइट में? तो क्या आंसर होना चाहिए अब? चीज, बियर, फिश और ऑल ऑफ द अबव? तो क्या आंसर होना चाहिए इसका? बताओ क्या आंसर होना चाहिए? All of the above, basically, because these all things will carry amphetamine or tyramine, and these indirectly increases the noradrenaline or adrenaline, right? So क्या करती हैं ये टायरामीन और एम्फीटामिन जाएगी साइनेप्टिक वेसिकल के अंदर, वेसिकल के अंदर जो नॉरेड्रेनालिन पड़ा होगा उसको कहेंगे तू बाहर निकल, दिस इज आवर हाउस, एंड खुद जाकर बाहर स्टे करेंगी, टायरामीन और एम्फेटामिन, और नॉरएड्रेनालिन बाहर आ जाएगा। नॉरएड्रेनालिन बाहर आएगा, देन इट कैन डू इट सिस्टमिक स्टिमुलेशन, और बीपी बढ़ जाएगा, और हाइपरटेंसिव क्राइसिस हो जाएगी। सो दीज थिंग्स आर सिंपल। Which of the following has least extrapyramidal side effects? Haloperidol, flufenazine, clozapine, and flufenthioxone. So your time starts now, and so 10 seconds are left, and yeah, we are having correct answer, that is clozapine. Clozapine is having the least extrapyramidal side effects, right? Right. Least extrapyramidal side effects. Clozapine is having least extrapyramidal side effects. Then buspirone, as compared to the benzodiazepine, is more potent anticonvulsant, does not interfere with GABAergic transmission, most effective in severe anxiety with panic attacks, produces significantly more sedation. So these are four options, and your time starts now. So 10 seconds are left, and 3, 2, and 1. So guys, buspirone is more potent anticonvulsant. No, benzodiazepines are way more potent than buspirone. Does not interfere with, yes, this is right thing. More effective in severe anxiety with panic attacks. No, not at all. Basically, ज़्यादा effectiveness is of benzodiazepine only. Produces significantly more sedation. No, benzodiazepines are first preferred sedatives, right? So B is the correct. And 233rd पे आए तो depression is not a side effect of propranolol, oral contraceptives, reserpine and flufenthixol. So depression is not a side effect of propranolol, oral contraceptives, reserpine, and flufenthixol. So your time starts now. Uh, 5 seconds are left. So guys, depression is not a side effect of flufenthixol. Flufenthixol was once used as an antidepressive medication. So, how this drug can cause depression, right? But propranolol भी डिप्रेशन कॉज नहीं करती, ओरल कॉन्ट्रासेप्टिव भी नहीं करती, रिजरपिन भी नहीं करती, साइड इफेक्ट नहीं होता, राइट? बट फ्लूफेंथिक्सोल was a antidepressive medication or is the antidepressive medication that was used earlier. तो इसका साइड इफेक्ट तो डिप्रेशन नहीं हो सकता. सो फ्लूफेंथिक्सोल इज द करेक्ट ऑप्शन, राइट? And 234th पर चलते हैं. Then schizophrenia can be treated with all the following except. So schizophrenia can be treated with all the following except pimolin, olanzapine, sulpiride, chlorpromazine. Pimolin, olanzapine, sulpiride, and chlorpromazine. So these are the four choices, and your time starts now. So 20 seconds are left. Time is over, and so schizophrenia can be treated with olanzapine, can be treated with sulpiride, can be treated with chlorpromazine, but pimolin के साथ नहीं हो सकता. That's why A is correct. And let's move to the 235th question. Which of the following is not a side effect of amitriptyline? Constipation, fine tremors, weight loss, and dry mouth. So which of the following is not a side effect of amitriptyline? Constipation, fine tremors, weight loss, and dry mouth. So your time starts now. 3, 2, and 1. So, which of the following is not a side effect of amitriptyline? So, that is weight loss. So, amitriptyline के साथ कौन से हो सकते हैं? Dry mouth, blood, vision, constipation, fine tremors, but and weight gain, right? Weight loss नहीं दिखता है इसके साथ, right? वेट लॉस के लिए हमने एक बहुत ही ज्यादा अच्छी ड्रग पढ़ रखी है, दैट इज टोपीरामेट. Which of the following drug may cause hypertensive crisis in the patient on MAO inhibitor therapy? Tyramine, guanethidine, phenobarbital, or epinephrine? तो कौन सी ड्रग है? फटाफट से बताओ. Your time starts now. तो यस, आंसर आ चुका है एंड या इसके लिए ज्यादा टाइम नहीं दूंगा मैं। टायरामिन इज द करेक्ट आंसर, राइट। और आप सबको पता है ये क्यों है, राइट। टायरामिन इनडायरेक्टली एनए एड्रेनलिन को बढ़ा देता है और ए डी, हाँ, एड्रेनलिन नॉरएड्रेनलिन को बढ़ा देता है एंड खुद जाके साइनेप्टिकल वेसिकल में जाके बैठ जाता है टायरामिन, राइट। और मेटाबॉलाइजिंग एंजाइम्स जो है ऑलरेडी इनहिबिटेड है, सो ज्यादा से ज्यादा नॉरएड्रेनलिन एक्ट करता है और उसकी वजह से हाइपरटेंसिव क्राइसिस में चला जाता है पेशेंट। एंड 237 की अगर मैं बात करूं तो एंटी साइकोटिक ड्रग विद लीस्ट एक्स्ट्रा पिरामिडल साइड इफेक्ट इज, एंटी साइकोटिक ड्रग विद लीस्ट एक्स्ट्रा, हाँ, चीज रिएक्शन भी उसी, हाँ, या इट इज आल्सो कॉल्ड एज चीज रिएक्शन। Antipsychotic drug with least extrapyramidal side effect is triflupromazine, thyroidazine, pimozide, and trifluperazine. So, antipsychotic drug with least extrapyramidal side effect is triflupromazine, thyroidazine, pimozide, and trifluperazine. And your time starts. 3, 2, and 1. So, thyroidazine is the drug that is having least extrapyramidal side effects. And 238 की हम बात करते हैं, which of the following drug treatment increases the thirst and causes dilute diuresis? Phenobarbital, lithium, chlorpromazine, and clozapine. So your time starts now. Yeah, time is over, and the drug is lithium. Lithium increases the thirst and it causes the dilute diuresis. And 239 question की अगर बात करें तो false statement regarding lithium is maximum plasma concentration is avoided due to the low therapeutic index, contraindicated in pregnancy, no individual variation is the rate of excretion, and 80% reabsorbed in the peroxis PCT basically, right? So false statement regarding the lithium, and your time starts now. 5, 4, 3, 2, and 1. So maximum plasma concentration is better to, yes, lithium is having a low therapeutic index, low therapeutic index. Yeah, it is contraindicated in pregnancy. This is also true. This is also true. It can cause Epstein anomaly, congenital heart diseases. No individual variation in the rate of excretion. Yes, ये चीज false है. And D, 80% reabsorbed in, yes. So option C would be correct. देन 240 की बात करें तो एक्स्ट्रा पिरामिडल सिम्टम्स आर अ कॉम्प्लिकेशन ऑफ ट्रीटमेंट विद फॉलोइंग ड्रग्स. Extrapyramidal symptoms are the complication of the treatment with following drugs: antipsychotics, anti-anxiety, antidepressants, and antimalarials. Extrapyramidal symptoms are a complication of treatment with following drugs. So, कौन सा ऑप्शन होना चाहिए? And your time starts now. Anti. 3, 2, and 1. The extrapyramidal symptoms are a complication of treatment of the following drug, that is antipsychotics. So extrapyramidal symptom antipsychotics के साथ दिखते हैं. And 241 की बात करूँ तो which of the following is an atypical antipsychotic? So which of the following is an atypical antipsychotic? Clozapine, chlorpromazine, thiothixin, and haloperidol. Clozapine, chlorpromazine, thiothixin, and haloperidol. So your time starts now. So 3, 2, and 1. Which of the following is an atypical antipsychotic? Uh, कौन सी है कौन सी है कौन सी है फटाफट बताओ फटाफट बताओ फटाफट बताओ. And A clozapine. Yeah, you guys are right. A clozapine is the atypical antipsychotic. Then drug useful in malignant hyperthermia is ये भी इसके लिए भी टाइम देना चाहिए क्या बताओ. बहुत इजी क्वेश्चन है वैसे तो, बट लेट्स सी. आंसर देना चाहिए क्या इसके लिए, मतलब टाइम देना चाहिए क्या इसके लिए? बहुत इजी क्वेश्चन है वैसे तो. इट्स रियली वेरी इजी क्वेश्चन, वेरी इजी, वेरी इजी, वेरी इजी क्वेश्चन. या dantrolene, you guys are right, dantrolene. And 243 की अगर मैं बात करूँ, एट एंटीसाइकोटिक ड्रग इज डॉक्सेपिन, फ्लोक्सेटिन, क्लोजापिन और ऑल. तो इसके लिए भी टाइम देना जरूरी है क्या? फटाफट से बताओ, फटाफट 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 फटाफट. हाँ. Yeah, you guys are right. C, clozapine. This is right. 244 की अगर मैं बात करूँ, एंटी डिप्रेसेंट ड्रग इज क्या ऑप्शन होना चाहिए करेक्ट? So yes, you guys are right. D, citalopram, antidepressant drug is citalopram, And 245 risperidone acts on which of the receptors? D2, 5-HT2, both or Na? So both का मतलब कि A and B is there, right? So कौन सा है 245 का? सो हमारे पास सी आंसर है बी, मतलब बोथ D2 and 5-HT2. Yes, you are right. And then neuroleptic malignant syndrome is caused by which drug? फटाफट से बताओ 246 क्वेश्चन का। और आज हम मतलब इस सेशन में हम 250 तक करेंगे और नेक्स्ट सेशन में हम कंप्लीट कर देंगे, राइट? बस 4 क्वेश्चंस और करेंगे एंड देन बताओ 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 246 का क्या होना चाहिए? बहुत ही इजी क्वेश्चन है। Yes, C, haloperidol. You guys are right. Haloperidol antipsychotic drug can cause this. 247 non-selective serotonin and noradrenaline reuptake inhibitor is sertraline, citalopram, venlafaxine or paroxetine. Sertraline, citalopram, venlafaxine or paroxetine. Right? बताओ बताओ बताओ। So yeah, we are having answers. Venlafaxine is the correct option. You guys are right. Then 248 का बताओ। half life of lithium is the half of lithium is। इसके लिए भी कोई टाइम नहीं दे रहा मैं, फटाफट से बताओ, फटाफट से, हमने अच्छे से डिस्कस करा था। एंड दिस इज द, नहीं अभी लास्ट क्वेश्चन नहीं आया है। सो 24 hours इज द हाफ लाइफ एंड यू गाइस आर राइट। एंड 249 की बात कर लेते हैं। थेरेपेटिक लेवल ऑफ लिथियम इन मिली इक्विवेलेंट पर लीटर इन अ पेशेंट ऑफ एक्यूट मेनिया इज। तो 0.4 to 0.8, 0.8 to 1.2, 1.2 to 1.6 and 1.6 to 2.0। फटाफट से बताओ 249 क्वेश्चन का। हमने ये भी डिस्कस करा था अच्छे से। So yeah, you guys are right. B 0.8 to 0.8 to 1.2 milli equivalent per liter, और अगर 2 से ज़्यादा हो then toxicity would produce. And last question for this session, 250th question. Which of the following drugs should not be given with tyramine as it may result in dangerous reaction? Which of the following drugs should not be given with tyramine as it may result in dangerous reaction? Cladribine, meperidine, trenicyclopromine and dextromethorphan. तो क्या होना चाहिए, क्या होना चाहिए? इसके लिए भी टाइम नहीं दूंगा, बहुत इजी क्वेश्चन है। एंड क्या वी आर हैविंग आंसर्स गाइस। आंसर आ चुका है एंड आंसर आया है सी, phenylcyclopromine. Yeah, this is right. And with this, I take your leave and will be meeting you today at 6 p.m. again. 6 p.m. या 6 p.m. से पहले मैं आपसे मिलूंगा, राइट? सो उसके अंदर हम सारे के सारे MCQs करेंगे। एंड मच फॉर कमिंग गाइस। वीडियो को लाइक कर देना, चैनल को सब्सक्राइब कर देना एंड we'll be meeting you today at 6 p.m. Till then, stay safe, stay positive. Stay healthy and keep fighting for your goals. Bye.